Hello everyone, thank you for joining us. I'm Jeff Archibald with TV Hamilton. I'm joined by Ron Konovich, President of Fort Hamilton Hospital, and Marcus Romanella, Chief Medical Officer. And I'm going to take off my mask. We've done the 6 feet of separation here. We're here today to talk about what's going on with COVID-19, the vaccination, all this information that you can find. These two gentlemen at Fort Hamilton Hospital are really here to give us the latest, the information that's going on. And let's start off with Ron. How has Fort Hamilton done so far handling the COVID-19 pandemic? It's not been an easy task.
No, it hasn't really. I've noticed there's a lot of fear out there, and fear usually comes from a lack of information or the unknown. And so hopefully as we spend a few minutes together here, we're gonna lower that level of fear in there by explaining some things to people. How has Fort Hamilton handled this? I think we are very blessed. I think the community of Hamilton is very blessed to have the resources that we have here at Fort Hamilton. We are part of a 9-hospital health system, and as part of that, the depth of resources is just incredible. And so as COVID has struck early in March, April of this year, we were able to expand beds, we were able to expand staffing, we were able to get the resources such as PPE and the gowns, the masks and things that are necessary that other smaller institutions had a hard time dealing with. And so, and then I also got to say the physicians here are first rate. I think we have probably the best critical care pulmonary physicians that I've ever worked with. We have here at Fort Hamilton Hospital. So I think we've handled it very well. We haven't had any real major issues.
Well, it leaves me, talking about that, you're 10 months in and it seems like everything's going as smoothly as can be after, such a bull rush at the beginning. It seems like you guys have really picked up your stride right now.
Yeah, smooth can be relative.
Yes.
Yeah. It certainly puts some stress and strain on us because we've had to deal with things we've never had to before. I mean, this is a once in a lifetime event, hopefully. And we've had to rethink a number of things and we've had to stretch. But I can tell you that the staff here, I call them healthcare heroes because I really believe that's what they are. They have worked extra, they have done everything to support this community, and I'm very proud of every one of them.
We look at where we were with COVID-19 back in March and where we are now is a very different place. Dr. Romanella, what are the latest for treatments with COVID-19 patients?
Sure, that's a great question. The treatments for COVID-19 continue to evolve and expand. The good news is, particularly with this virus, the vast majority of people who become infected, if you're young, healthy, or have no major medical conditions, require no treatment whatsoever. They simply are expected to improve on their own and the condition will resolve. For those who are afflicted in a much more serious way, we stand ready for them. We have implemented a number of new treatments, including, for example, outpatient monoclonal antibody therapy. This is very similar to what the president received, where if we can give you an infusion of antibodies, we can hopefully prevent you from getting sick enough to get hospitalized. We have very specific criteria. We identify patients who are at risk of being hospitalized from the COVID-19 illness. So the moment they get sick, if we get a positive test on them, we see if we can enroll them in our outpatient infusion clinic. The virus is unique in about every patient who ultimately does get sick enough to require hospitalization seems to show up around the same time, right around day 7, 8, 9. That's the time we typically see patients coming into our emergency department who are sick enough to be hospitalized. They're requiring oxygen therapy. They're requiring some breathing support. Sometimes that includes positive pressure ventilation like BiPAP or CPAP. Many people wear these at night when they have trouble sleeping with sleep apnea, so some people may be familiar with those machines. We try and utilize those machines over where we were about a year ago when we were utilizing a lot more mechanical ventilation, placing people on ventilators. The science has caught up with COVID-19 to show that the longer we can keep you off the ventilator, the better off your outcome is likely to be. Now, for patients being hospitalized, we've found that science is supporting steroid use early. So if you're requiring oxygen therapy, we're using IV steroids to support your condition, as well as plasma donated by our community with antibodies in it. So a huge shout out goes to the community for donating that plasma, because without it, we would be really short a very beneficial treatment. We also utilize remdesivir, the antiviral therapy, where appropriate. The data has shown that it's only utilized best in a very specific window of time. And a lot of the patients who are hospitalized are really outside the window in which they're going to get a lot of benefit from the remdesivir. Mostly it goes back to just fantastic bedside clinical care from our ICU physicians and ICU nursing staff, as well as on our floors. where providing the patient with good hygiene, support, vitamins. I can't say enough about how much it means to be up on your vitamin therapy. Vitamin D and C are shown to be supportive in the immune system, and we utilize those here as well. And so the therapies over the last year have really evolved to now I feel like we're making a significant impact in patient outcomes.
So looking at that, my mom was a nurse and she always had the phrase, and I heard it nonstop throughout my life, an ounce of prevention is worth a pound of cure. What can Hamiltonians, anybody really do to help stop the spread?
Stopping the spread first goes to containment. We are really, as a community, our own worst enemy in this pandemic. We love to get together. We love to get together with our friends and our family, where if we're not recognizing how dangerous that can be for our loved ones who have long-term health care conditions or are elderly, that act of getting together and sharing a virus can be deadly. And so it's important to maintain as much social distancing as possible, to look out for those in our family units, but also recognize when we're sick and get ourselves completely away from our friends and neighbors and our family once we do start to experience any symptoms.
One thing you guys mentioned, or didn't mention, but you alluded to, COVID-19 fatigue is a real thing. People get tired of saying, I've dealt with this long enough, I don't want to deal with it anymore. The virus doesn't care what you think, right? You have to continue to do the right things.
Yeah, very, very true. Our staff, like I said, they have been working very, very hard, and the COVID fatigue is real. We have special support groups for them. The death rate is out there. There's no doubt about it. And experiencing that death on a day in and day out basis can be very taxing on staff and emotionally draining.
Yeah, I think the biggest thing people are talking about right now, we can get into it, the vaccine. Man, that looks like a breath of fresh air as we move forward. So really the question is, people want to know, how can I sign up for it? What does the rollout look like? Where are we at right now in the process?
Well, I think Marcus can help me with this, but there's a number of things. I believe there's been in the state of Ohio, about 360,000 doses of vaccine administered already. And what we are looking at is some community vaccination clinics. Well, let me back up and just say, there's phases that we are following from the guidelines of the state and the governor. We're in constant communication with the governor and his office, and this information changes on a daily basis. But we are working to set up community vaccination clinics. The website to sign up for the vaccine for our network can be found at ketteringhealth.org/coronavirus. Now there is phase 1A and 1B. 1A is behind us. That's been the last few weeks, and that was administering vaccines to the frontline healthcare workers. So those are anyone treating COVID-19 patients, nursing home staff and patients, other locations, etc. But 1B is actually going to be administered to the public, and this is starting with people age 80 and up. And so that actually started this week. And you'll notice in all the vaccine clinics that you will find in the community, and I believe there's about 1,700 providers registered in the state of Ohio to administer vaccines.
One thing that a lot of people have questions and concerns about is the safety of the vaccine. Dr. Romanella, can you speak to how safe is the vaccine? Should people feel comfortable with it?
At this point in time, all the data we have shows that the vaccine has a very high safety profile. The vaccine is designed to induce an immune response. That immune response will include symptoms like a sore arm, fever, fatigue, malaise. Those aren't side effects, those are intended effects. And some people will experience those more so than others. And so do not be wary of those type of symptoms. Long term, we'll see how effective the vaccine can be. The preliminary data that supported the FDA's authorization of these vaccines was very reassuring, in so much as a large portion of people were able to prevent serious COVID-related illnesses after receiving the vaccine.
Ron, back to you talking a little bit about that rollout. Right now, you're right, it's 80 and up, and every week or so it drops 5 years. Is that what they're talking about right now?
That is correct. We're on an accelerated schedule to roll out these vaccines. We want to get them out there as quickly as possible, along with the states. So this week we are 80 and up. Next week it is 75. Age 75 and up. But the following week is 70 and up, and then finally, the week of February 8th, it would be 65 years of age and up.
Now, one thing that has been really good for me to see is you guys have been working very collaboratively here at Fort Hamilton with other agencies throughout Butler County. Tell me a little bit about what you guys have done to really be a community member and step up and help out everybody.
Yeah, this clearly is a team effort, and there's no us. It's a we. It's a we sport here, and so we have shared resources. We've shared vaccines. We've shared knowledge. We've shared supplies. So, without naming names, I can tell you there's been other health systems that have been short during this pandemic of certain things, and we readily share that with them, and vice versa. As a community, I am very proud of what we have done here in Southwest Ohio. It is amazing.
One thing that I want to touch upon, because we see in the news and things along this way, and I think Dr. Romanella can talk about this, the virus variants that are out there. What should people know about that? What should they be concerned, not concerned about that?
Sure. Every virus we encounter changes over time. That's the nature of the way that variants come about. Over time, changes in the DNA or RNA of a virus or an organism, for that matter, add up. The ones we're seeing so far, the variants we're seeing, and scientists continue to analyze these evaluate these on a daily basis to look for new variants, show only minor nuances and minor changes in the spike proteins of the coronavirus. At this point in time, we're showing no evidence that this is going to impact the COVID vaccine efficacy. So the vaccine should still generate an antibody response in your body such that you should be able to attack the spike proteins of the virus if exposed to it. They are different, but slight enough that it's not going to make a major impact in your immune response at this point in time. There is some suggestion that maybe the virus has changed such that it's more easily spread, but so far we're seeing no evidence that suggests it's more virulent or more harmful than it has previously been.
That's a positive, I guess. If anything can be a positive,
It's very good news.
that would be as close as we can get to a positive.
Yep.
Gentlemen, before we close, any final thoughts? And Dr. Romanella, we'll start with you. What do you want people to know about COVID-19 today as of right now?
COVID-19 is something that continues to threaten just our way of life. We've all had to change and adapt to it. I think we're going to have to remain adaptable as the science evolves and shows us how we need to change the way we behave and the way we interact with each other. And we can do that. This is a very strong community that's able to overcome a lot of things. And I've just been very impressed by the outpouring of support from the community who's come into the hospital to show their support for our frontline staff. And I'm grateful for that. I think that moving forward, by vaccinating, by doubling down on our preventative efforts, that we will overcome this pandemic.
Ron, final thoughts from you?
I would say some people are experiencing this fatigue. They haven't visited parents or family members in quite some time. Just be cautious. Maintain the mask wearing, the same precautions that have always been there. This has been very beneficial. This has been helpful. And also stay healthy. Like we mentioned, there's a lot of things you can do prophylactically, preemptively to stay healthy, and that will certainly help if you are, for some reason, exposed to the virus. And I would actually like to end by thanking the healthcare workers, and that's the EMS, that's the health department, that's hospital employees, physician offices. This has been a very stressful time for all of them, and as a community, I'm very thankful to have each one of them, and we have done an amazing job, I believe, in this area. So thank you to every one of them. I
think Fort Hamilton has done a fantastic job throughout Butler County, throughout Hamilton, and helping our citizens and all of our community members get through this difficult time. And I think what we can see right now is the light at the end of the tunnel. But it's still a long tunnel, but there is light, and we can get there as long as we do the right things and the smart things and make the right decisions. Well, gentlemen, I thank you both. Ron Konovich, president of Fort Hamilton, and Dr. Marcus Romanello, Chief Medical Officer at Fort Hamilton Hospital. Thank you all for joining us, and we'll have more updates as things move along and throughout the process. Thank you.